Good evening, everyone. Mark Twain once said, "It usually takes me more than 3 weeks to prepare for an impromptu speech." Well, I tried to do this one in less than a day. Thousands dead, lockdowns across the globe, economic plummet, chaos, healthcare systems overburdened, thousands in line, an unforeseen future. Those are some of the headlines that we've seen in the paper the past couple of years during this unforeseen pandemic that hit the world in 2019. I want to assure you that we can prevent that from ever happening again. We have learned a lot, and what is needed is strong determination and leadership to effect change. Let me begin by asking you a simple question, and kindly keep your hands up once you raise them. Who here has joined MUN before? Keep them up. Who here wrote for a school paper or uni paper? Who here has worked on charity with friends and colleagues? Who here has worked on communication and presentation skills through debate clubs and other clubs of the liking? Well, as you can see, there's a wide variety of people and a wide range of people who have done so. Despite all of that, there is still a long-standing, to this day, misconception that extracurriculars or ECAs are a waste of time, and that students should only focus on their studies and academic performance. Those are hand-me-downs, and we have to change them, and we should not accept them, because I personally have gained a lot from ECAs, and they have shaped the man that I am today. I'd like to take you on a quick walk with me down memory lane. I spent half my childhood moving from country to the other. I spent no more than 2 years in a single school. All while people would think that this would have a negative impact on people because of instability, it has been overwhelmingly well for me. Transitioning my living conditions from developed nations to underdeveloped ones, it instilled in me openness to diversity. It made me a citizen of the world. All the while, strongly believing in my values and traditions. After finally settling down in Egypt, I spent 5 years in university joining every single ECA out there. To the extent that even after I graduated, and waiting for my military service, I was still GCMUN Secretariat. And then after I joined the military, I would go during vacations and spend a considerable amount of time giving sessions and training sessions. Most recently, I am very grateful to have been selected from a group of 65 individuals, executives in the government from around the Republic, out of more than 8,000 applicants, to be part of the Executive Presidential Leadership Program, with partnerships with l'École Nationale de l'Administration, l'ENA, in France, the Geneva Center for Security Policies, the GCSP in Geneva, Switzerland, the National Human Resource Development Institute, NHI, in Korea. I was always determined to be a factor of change in Egypt, to help transform society for the better, have a pivotal role in changing people's lives and elevating them. That desire was magnified after the revolution, and after graduating from uni the first time in 2011. We were young and youthful. We were filled with energy and believed in our power to affect positive change in society. With every year passing, I believe that I made the best career choice for myself almost a decade ago. Giving up lucrative positions and jobs in the private sector because I always believed I had a duty to the public that I wanted to do physically, promptly, and instantaneously. Even though people would say that renewing the public sector is like moving a graveyard, you can't get help from those already in it, I believe differently. I started off my work in a secluded community medical center in the governorate of Fayoum. I spent a year there, and then moved to Cairo, where I spent 3 years in a medical center dealing with a wide variant of people, with the most frequent visitors being those who really need medical assistance and help. Always try to take initiative and help as much as I can. I would use my personal car and go for medication runs, get medicine when I would know that medication would not reach the patients on time. I would carry huge boxes by myself, do things that were not required of me, and I would do them with absolute joy and happiness because I know it would affect change. After moving up the ladder, and in April 2019, I joined the Minister of Health and Population's cabinet working in foreign relations, the epitome of my desire. It took me almost 7 years to realize that God has a greater plan for all of us. After failing repeatedly to accomplish my ultimate dream and join the Egyptian diplomatic corps, despite very hard work and applying to it repeatedly, passing the exams and still not getting in, I now became the youngest member of the ministerial delegation to the United Nations General Assembly in 2019, in the most significant and major healthcare event on the multilateral level. Being within the inner circle of policymaking in the country makes affecting change a reality and not just an aspiration. As my role model Muhammad Ali says, the more we help others, the more we help ourselves. There was and still is tremendous effort to combat the socioeconomic and humanitarian aspects rising from this pandemic, nationally, continentally, and globally. I was lucky enough to be part of a huge team that has a role in transforming healthcare services in our country and going through a pandemic of this huge scale, a pandemic that the world has never witnessed before, where someone affected in the north could easily transmit to a citizen in the south. Someone in the east is not safe from someone in the west. Furthermore, something I see firsthand in my line of work is the change in our African continent. The African Union created the COVID-19 Response Fund to minimize and contain the social, economic, humanitarian impacts of COVID-19 within all African countries, as well as support procurement and distribution of COVID-19 essential medical equipment, supplies, along with mobilizing response by member states, international community, and development partners as well. Over 7 million cases and almost 180,000 deaths with an Ebola outbreak in our continent. We continue to effectively rally resources as quickly as possible for that fund that acted as a locomotive for the implementation of the African Union's COVID-19 continental strategy. I believe what is required of us today is a new era of accountability, because we have duties towards ourselves, our people, and our continent, and humanity as a whole, to prevent the inequality. There are more than 75% of global vaccines that were used in only 10 countries. Want to hear another shocking fact? The total expenditure to combat COVID-19 is over $8 trillion, and only 0.3% of that went to the most vulnerable segments of people within developing nations through multilateral aid. Here's another shocking fact. There are 780 million people worldwide below poverty line. Imagine that we're going into 2022 with people without basic food, water, shelter, sanitation, or healthcare access. IMF Executive Director suggested that by the end of this year, 2021, we will be able to reach 40% vaccinations globally, and by the end of next year, 2022, we'll reach 60%. Unfortunately, those numbers will not be achieved because some developed countries would use their resources to realize self-serving agendas and goals. I strongly believe that we can only solve the challenges of our time collectively. We must do everything we can to make sure that our planet lives up to the expectations of our children. We should be relentless in our pursuit of health, cooperation, and respect for each other. Learn from this pandemic and prepare for an inevitable coming one. Egypt has taken that concept and applied it head-on with other African nations, accommodating the unprecedented 100 Healthy Million Lives campaign within Africa and helping countries prepare for a pandemic. Simply, there can be no just Africa without reaching every individual in the continent with healthcare coverage, especially during troubling times like these. I would like to take this opportunity and emphasize the great importance of the continuous and fruitful collaboration across our continent to build on strong partnerships with the private sector, international organizations, NGOs, different stakeholders, global funders, and the pharmaceutical industry. Collectivism is the new cool. A great initiative like COVAX should forever change how the world deals with catastrophes and disasters. A coalition between WHO, Gavi, CEPI, to help expedite delivery of vaccinations to developing countries to jointly reach the end of the tunnel, where a shining light of a bright future awaits for all of us. African nations sat together at the beginning of the pandemic and decided to combat this pandemic in unity and to negotiate with our partners as a united front, and that proved to be very useful for every African nation. If you remember at the beginning of the pandemic, when the world was in chaos and uncertainty, Egypt sent aid and support to China and Italy, with the Minister of Health heading that delegation. If that is not collectivism, then I do not know what is. The COVID-19 pandemic is a global challenge, one that has taught us that through union and perseverance, impossible is nothing. Once the scientific community decided to work inclusively, a process like finding the right vaccine that would usually take at least a decade was possibly reached within less than a year. Countries with developing healthcare systems were able to combat the pandemic and prevent loss of life. All the while, we read headlines that said COVID is teaching the US a crash course in scientific uncertainty because no one was safe. 192 member states of the WHO got together in the most important World Health Assembly to date in Geneva, May of this year, and decided on 30 resolutions, decisions, and declarations within the 4 main pillars of the Assembly, one of which is holding an extraordinary session upcoming November to discuss an international treaty on pandemics adopted under the WHO, which would enable countries around the globe to strengthen national, regional, and global preparedness capacities and increase their resilience for future pandemics. Another resolution that obviously highlights the unequivocal importance of collectivism is strengthening local production of medicines and other healthcare technologies. This would help developing countries get the technological know-how to be self-sufficient, depend on their own, and not be fully dependent on developed nations. This all began in 2009 with me sitting on a table in GCM UN Security Council, simulating the foreign policy of a nation that I was assigned, which was China, by the way. And then, fast forward to 2019, I'm sitting behind a placard that says Arab Republic of Egypt, giving a statement on behalf of this nation in the most important African Union healthcare event. And then 2021, thank you. Then 2021, I was the ministry's envoy to the World Health Organization, WHA 74, in Geneva, Switzerland. I'd like to leave you with a statement that I think that you should think about very deeply. As Muhammad Ali once said, half a century ago, service to others is the rent we pay for our room here on earth. Thank you.